Hi guys, welcome back to the channel. I'm Freyja and I have the lovely Juliana. Thank you for coming.
Hi Freyja.
This is a special video for the ECAs, the EAAs out there, and for also non-ambulance clinicians out there, so general public. If this can help you guys, then I'm hoping it's going to be of some resource. So, Juliana, I have some questions for you.
Okay, let's do this.
Okay, so you're a mental health practitioner.
Yes, I am.
Okay, so can you tell me what your role is as a mental health practitioner in the ambulance service?
So our main role is to provide specialist mental health advice to anyone out there who is experiencing an acute mental health crisis, who had contacted 999. And we're specialists, so that means that the ambulance service can send or deploy specialist care.
So we've got this mental health car. We're actually in one of the vehicles. It's pretty big, isn't it? So we've got nice seats at the back. We've got a seat that's forward here as well, and we've got the driver in the passenger seat. But there's quite a few vehicles out here, especially in the South West Ambulance Service, which we're part of, who've got these vehicles. Why do we need them?
Well, that's a very good question actually, because this pilot started in London. The word has spread around the ambulance services as to the amount or the increase of mental health jobs that the ambulance services was attending. And there was a need in the service, or a gap in the service, in that we weren't quite sure how to or why we needed to deal with any mental health crisis. So this is how the idea of the mental health RRV came out, where we could see anyone, anywhere, and perhaps we can provide a nice space for them to talk to someone, to have that assessment of their needs, and to be heard, really. From the logistical point of view, it means that if the mental health car goes to a job, then the trucks can be used for other jobs that are much more acute or that require an immediate attention in terms of physical health.
Hence why the ECA, the EAA is with you as well.
Yeah.
So we're doing the physical side as well as the mental health side.
Yeah.
And both are just as important as the other.
Absolutely.
Yeah.
So having an ECA with us, it means that, for example, if somebody had caused some kind of minor lacerations, they can be sorted and discussed there and then. Then the person can be seen on scene, treated on scene. So how I can put it is that if anybody thinks of taking a patient to hospital to be seen by psychiatric liaison, psychiatric liaison has moved into the ambulance service, and that's exactly what we do. We provide that mental health assessment of needs at that point of contact, so they don't have to go to hospital, for example.
Yes, of course, because a lot of we've seen in the ambulance service that where we don't know what to do with the patient, they go to hospital to ED, and a lot of times ED is not the place for them, is it? I mean, it's, you know, when they might get some psychiatric help there in time, but if we can sort of establish the problem there and then, maybe in their household where they are or where we found them, and give them that treatment, as it were, straight away. It's timing is the essence, isn't it?
Absolutely. And certainly the feedback we had is that, you know, people that we treat and see, they're very happy that they've been left home, that they haven't had to go to a hospital, because there's a lot of other things that need to be taken into account when they're discharged. There might be a cost involved to them.
Of course.
They might be really far from home. They might don't even have the means to get back home. So they might experience unnecessary stress.
Yeah.
So that's why we're here to provide that really good quality service, trying to avoid any kind of distress to the person, and we kind of carry hope for them.
So another question I have is, what is a typical job on the car that we go to?
Wow, that is...
You didn't know that question, did you?
That's interesting, because I will say anything, but I'm saying that in the ambulance service, you know, so in the same way that you guys go to anything that's 999, certainly
the world's the oyster for that, isn't it?
Absolutely. So it's 999 for mental health. I guess I will say you will see mental health and mental fitness, and I think that's an important concept. That as a mental health practitioner, my main role is around assessing the needs of somebody's mental health, but what we do see a lot is mental distress or mental unfitness. So it could be anything from a young person who might have a new diagnosis or hasn't had a diagnosis yet, and that might be presented with very kind of high risk issues. So, you know, you will assess a young person in the same wave of length. You can end up assessing a really elderly, fragile lady who suddenly is very confused, who suddenly is perhaps experiencing some kind of psychosis, and I think that's where the expertise between physical and mental health comes. Because we need to look at, is the lady presenting as psychotic because of physical health,
or could be an UTI that's actually come through and then presenting as a mental health, but actually it's not. So
absolutely,
that's why we've got the two, haven't we? The physical and the mental health side.
And I guess in the jobs we have access to all our to RIO, which is the mental health system that we use, and all that information is what we bring as well. So when we make a decision, it's based on what this person has, because a lot of people will have history within the mental health services. So that's the kind of jobs that we can go to. We can also get jobs around emergencies, around suicide, perhaps people who place themselves at a huge risk of death by being on bridges and things like that. But that's where our collaboration comes in, where all the agencies understand that the police will have a role in terms of making that scene safe. Physical health services will have to be there, but eventually, you know, the mental health nurse will be there to try and ascertain why the person is in such distress, and what we can put in place for that. And I think sometimes what people don't quite realize is that we're not police negotiators just because we're mental health. So that's an important difference, I will say. But once the person is in a safer space, then that's probably when we take over, and that's when we try and use all the tools that we have in our back, in terms of, you know, how you talk to the person, maybe a little bit of some kind of therapy, or, you know, advising on medication, and that's kind of the jobs that we will go to.
So I've got another question for you.
Okay.
Ding ding ding. What type of services are there for the mental health? So for somebody in the ambulance service, who could they contact if they've got a patient who is in crises, for example? And also, and what type of services are there for the general public if they've come across, you know, a potential mental health issue with their family, friends, or whatever?
Okay. So within Dorset, anyone that has got a query about mental health can first of all contact their GP, which is 9 to 5, but they can also contact NHS 111 option 2, and that call would be directed to the mental health practitioners, who can give kind of information around where to go next with this person. If it's a third party, and they do get a lot of calls from third parties saying, I'm really worried about my friend who maybe disclosed certain things, how do I go about it? So that's one of the services that are open for the general members of the public. Dorset has just gone through a little bit of changes in their community services, so it's an improvement actually into what there is. So you'll have the retreat in Bournemouth, which is up in Hanneman House, and just now they have just opened or relocated the retreat down to Weymouth, and those services, the retreat in Bournemouth is open from 4:30 in the afternoon till around 11 o'clock. And the hours will be similar for Weymouth, but I think the days are a little bit changing. There's also something called the community front rooms, that they run for shorter spaces of time, but the kind of theme is the same. These are places that people can go as a safe space, and that's what they call the retreat, to retreat from everything else that's going in your mind. And when you go into these places, you can just sit, use the cafe space, have a cup of tea, coffee, nothing, just, you know.
Comfy chairs as well in retreat, isn't
absolutely,
there?
yeah, you've been there.
I've been there, yeah. Nice coffee as well.
There you go. Or you can request to speak to someone, you know. They are incredibly important to the community because they have a model in which they also have or work alongside peers specialists. So these are people who have a living experience of mental health.
First-hand experience.
First-hand experience, yeah. So they are incredibly valuable to whoever, you know. They can share their experience and they can really say, I really know what you mean.
So I think we talked earlier, we talked about empathy, so they can empathise and not sympathise, which are completely different, isn't it?
Completely different. And I guess those places also can be used around helping people to build up the other part that we were talking about around their mental fitness. So the idea that you don't have to wait for a crisis in order to learn about your mental health, that these resources are there, that you can use them just to have an insight as to what would I do when I get to a crisis. You know, how do I become when I'm in a crisis? Who do I need to contact when I'm in a crisis? So they do a lot of the kind of public health learning around what to do prior to a crisis. And I think the best thing would be to check the Dorset Healthcare website, because they do have really good links to those services in terms of the community rooms, the retreats. Now that we're in the digital era, we do recommend self-help apps. And again, if you go to the NHS website, there's a list that you can download, and those ones are evidence-based. They're backed by the NHS, and it helps people to manage anything from depression, anxiety, emotional dysregulation.
There's a lot out there nowadays than there wasn't, say, 10 years ago.
Absolutely.
There's so much more help out there for mental health, isn't
absolutely
there?
Absolutely. But if it's in the first instance, if the crisis is such that the person is at high risk, then obviously we always say to the general members of the public to call 999. Sometimes in Dorset, if you call connections, they will kind of try and see if perhaps the person can be taken to the retreat. So they would always try to find a way to get an assessment to the person. Sometimes connections might be able to provide a face-to-face assessment, but if that's not possible, then the retreat, and then we have 99.
Yeah, brilliant. Can you take us through a typical scene where ambulance is there, you're there, police are there? You know, can you give us sort of a feeling of what happens and how things are done?
Okay. Our main aim within the mental health RV is to be dispatched to scene as soon as possible, of course. Then I will be looking to get a handover from the ambulance, the paramedics, get a handover from the police, kind of cast my eyes with the patient. Like I said, sometimes we do have a wealth of information on the person. We might have come across them before. Then I will ask the paramedic if the person is medically fit.
Yeah.
And then in terms of the police, just making sure that the person hadn't been arrested or haven't committed a crime, you know, all those things. And whilst I'm doing that, I'm also assessing the level of risk that the person might present, because what I will be thinking of is, can the services go? Can I take over within the resources that I have? And
so
again,
just keep what's needed and let the rest go.
Absolutely.
Yeah.
And I think, just connected to the first question, around what is it that we do, that's another part that we will do in terms of keeping the other services running, because the specialist services has arrived.
Yes.
So if, for instance, I know that the person's risk don't present that there is a need to relocate, to go somewhere else, then the police can go, the ambulance can go, and generally we will have a conversation with the person here in this environment. You know, sometimes we might have somebody that just been to the water, or they might be a little bit wet and it's winter, but they're physically well, they don't need to go to a hospital. So we will make sure that this environment is nice for them, that they have blankets, and then we will engage in the actual assessment of their needs. Sometimes for people is the way that they had available at the time to show their distress.
Yeah.
Sometimes as a result of the assessment, actually we might find out that the person needs to have an inpatient hospital admission, but most of the time we have been able to convey on scene, treat on scene, or take home if we can.
Lovely. Well, thank you so much, Juliana, for this lovely conversation, and I'm hoping that this is going to help you guys out there when you come across your own patients with mental health crises, or if you're not sure what to do, or if you're a member of the public and you're thinking, I think I've got a friend or family that is going through some difficulties. I'm hoping this video is going to help you guys, and hopefully we'll see a better future for our mental health persons out there.
Absolutely.
So thank you very much for your time.
Thank you for having me.
And thank you again for joining us, and I'll see you on the next time. Bye bye for now.